There's various different things that have happened in the past few weeks whilst we've been away. One of the biggest ones is the fact we've got a new health minister. Can you believe it? And in this episode, we're going to talk about that. We're going to talk about people leaving as well. Some you may not have realised have left. And in addition, some other things like the new Pharmacy First scheme. That's right, we've got some hot news off the press today as we tech enhance your primary care and learning. Shall we get cracking? Hello, eGP learners. Welcome to this episode where myself and Andy are back after a little bit of a break, and we're here to talk about some seriously interesting news. In fact, I think the last time we went live, we kind of talked about the fact that we hadn't had a change of health minister for so long. I guess we kind of jinxed it, didn't we, Andy?
Yeah, I'm loving your enthusiasm for the sixth Secretary of State for Health and Social Care that we've had in, I think, about five years. But loving the energy that you're bringing to it tonight. So I guess we'll be spending a lot of time just introducing ourselves and people to Victoria Atkin, the new Health Secretary, as we often do, and celebrate the entry of a new Health Secretary into one of the toughest jobs in British politics. And then there's just a few other stories to touch upon. I think some issues with the RCGP new online video assessment exam, and just celebrating sort of Nikki Kanani's departure from NHS England, often friend of the video podcast. So yeah, shall we get cracking? Oh, I guess there's people out there. Always nice to welcome the audience as well.
Definitely. Yeah, so hi to eGPlearning Podcast regular Miss Melody. She's saying good day and welcome to us all. Absolutely, if you're joining us live, feel free to say hello and let us know how you're getting on. We kind of missed our soft start today. We were running a bit overdue from our upcoming episode that is going to come out next week, which if you're involved in rotas, you will absolutely want to check out and stuff next week. But let's get cracking with the big new news story, and that is our new health minister. Why don't you lead us into this, Andy?
Yeah, so I guess we're recording this on a Thursday. So on Monday, Rishi Sunak had a big reshuffle of his cabinet. I think it was Suella Braverman was out, and then other people were reshuffled around to account for that, with some other departures and other entries into the cabinet. But the big thing for us is that Steve Barclay, who'd been in position for about a year, so actually one of our longest serving health ministers for some time, and actually I think he'd been in the job twice, as we'll see in a second.
As far as I know, he's the only health minister to have done that, to actually have the job on two separate occasions.
But Steve has gone and has made way for Victoria Atkin, who is MP for Louth and Horncastle, which is in Lincolnshire. I once worked in Louth Hospital in Lincolnshire, Gandhi.
Wow.
Yeah, long time ago. That was when I was, I guess, what people call an F2 now, or ST2, or whatever they'd call it these days. So yeah, some time ago. Interesting place, very small, rural Lincolnshire. But shall we have a look at the last health secretaries that we've had for a while? The interesting, Gandhi, in preparing for this, I think we have now learned how to write, the press article when there's a new health secretary, because I think what we're finding is going to our primary sources, we come up with exactly what the press sort of come up with in terms of the output. So interestingly, Jeremy Hunt was the last person to be in the job for a few years, and he was about 6 years from 2012 to 2018, and then in the 5 years since then, big picture of Theresa May there. We've had 6 people in the job, and one person in the job twice, Steve Barclay. So we've had Matt Hancock, who everyone remembers.
But to be fair, did do the role for a reasonable length of time. I think he was in there for almost
3 years.
3 years, yeah. So a significant period of time. But like you said, and then succession from then, in the space of about 2 years, we've had 5 different health ministers, 4 different people taking on the role.
Absolutely.
Yeah.
Often as the prime minister's changed. So we had Sajid Javid. Then we had Steve Barclay. Then we had Teresa Coffey, who was in there for a very, very short period of time, just 6th of September to 25th of October. Then Steve Barclay back in for a longer stint, been in there for about a year, and now we've got Victoria Atkins in there now. And I guess let's talk about and introduce ourselves to Victoria Atkins. So she is fairly young. This is how they write the articles. We've found they go to Wikipedia. You can tell what they've done when you read the articles and you go to the primary sources. So Victoria Atkin, so interesting background. So daughter of a lady and long-standing Tory MP Robert Atkins, whose name I do remember actually from a long time ago, being sort of present in the Tory party. That Atkins name I remember. Interestingly, age 3, diagnosed with type 1 diabetes. So that's interesting for us, isn't it? Because she must have had quite a lot of contact with the health service, her GP, and other teams looking after her care. So that's interesting. She is trained as a lawyer and a barrister, I believe, and then came into Parliament in 2015, I think, in that election as MP for Louth and Horncastle. And then while she's been in the House of Parliament, she has had a number of jobs from 2018. She was the Parliamentary Undersecretary of State for Women, and then she was the Undersecretary of State for Safeguarding, and then Minister for Afghan Resettlement, Minister for State for Prisons and Probation, then First Secretary to the Treasury, which I think is the second most senior job in the Treasury, I gather from reading other articles, before being made Secretary of State for Health and Social Care. So, any thoughts on that background or career so far, Gandhi?
Relatively broad kind of exposure and stuff into things, and obviously some elements if you're looking at it. So obviously there's the stuff about the resettlement side of things, depending on which side of the coin you take. Her perspective on that could have real impact in terms of health inequalities and things. I think, like you mentioned, obviously the fact that potentially she's been having to use healthcare services because of an early diagnosis of type 1 diabetes, which would have a significant amount of involvement with healthcare needs, particularly at that age. Both her experience as a young person transferring over to an adult into those kind of services as well, which we know that there's often some elements of challenge when that happens to individuals as well. So yeah, an interesting catalogue of stuff there, really.
Yeah, interesting. And I guess just contrasting her background with Steve Barclay, I think Steve Barclay had come very much through a sort of consulting and business background, worked for Barclays Bank, I believe, and possibly done some business consulting as well. So he sort of brought that attitude, I guess, to the current trade union disputes, that are happening. There's a certain perspective from that, and maybe there's a different perspective that comes from that legal background. Will be interesting to see how that develops. What we always have a look at and what they do when they write the articles is they go on theyworkforyou.com to look at the voting record. It's really good. I think it's provided by, I think, Hansard, who do all of the sort of reporting on the activities within the Houses of Parliament and the Houses of Lords. And you can go and get a little sort of biography about the person, and then you can browse their voting record, and we'll have a look at health. And it just tells you how they've voted on different issues. Just 2 entries in here. It's voted for reforming the NHS so GPs can buy services on behalf of their patients, and has never voted on allowing terminally ill people to be given assistance to end their life. So there's not a lot of data in there. We've had health secretaries who've been in Parliament for longer. That section's been longer, and you can potentially deem a little bit more about their beliefs from it. Although what you tend to find is often MPs will vote with the party line, so it often reveals more about the attitude of the party than individual MPs. So interesting
data,
yeah. So I guess, Gandhi, she's new to the job. Any thoughts about what's in her inbox as she comes to one of the most challenging roles in British politics?
Well, I mean, there's going to be some key things at the top of that list, isn't there? There's absolutely going to be the concept of winter pressures, and what does that mean for the NHS? Because we're about to hit, the crux of winter. We've had some fairly nice weather. We've then had some fairly chaotic weather, and it's not untoward that that's going to be an issue. Absolutely, the NHS backlog continues to be a challenge for every single part of the healthcare system. And added into that is obviously the strikes. Now, we've not heard much about the strikes whilst me and you have been away, have we? There were a couple, and it's kind of gone a little bit quieter at this point. But it will be interesting, I think, to see what happens moving forward, because obviously there's been no resolution. Barclay obviously had his perspective of how he's handling the strikes, and depending on which side of the coin you want to listen to, obviously the the BMA side of it was very much that he's not talking to us, and his side of it seemed to be, well, I'm not talking to anybody, or I'm not quite sure how he categorized it, to be honest. But there was no discussions really being had. So it's really going to be interesting to see what happens now, whether Victoria Atkins is going to take a different stance into how she addresses the strike actions and stuff. I mean, what do you think is probably in there, Andy?
Well, the intray. So, gosh, there's so much in there. There's the ongoing industrial disputes and strike action that are happening. There's always always reform in the NHS, pressure for value for money. People always talk about not just putting in more money, but constantly reforming the NHS. And every sort of new person often publishes their own, give them time, they'll publish their own new report on how things can be changed. So I perhaps wouldn't welcome another new perspective. I think sometimes you just need to follow through on what's on what's planned. There's obviously a new GP contract next year, so it'd be interesting to see her perspective on that. And then of course, there's just the general challenges to the NHS that grumble on. The demographics are changing. People are living longer. People are living longer with illness. There's more things that we can possibly do to help people's health with technology and new drug treatments. People are living longer, and there's always a funding squeeze. So it's gonna be difficult. And I guess there's a general election coming up as well, which might mean that there's pressure to make some announcements on health and say what is going to happen in the future. So I think she's going to be very, very busy.
Very much so. I mean, we can harken back to the 6 key priorities that we saw that Steve Barclay published a few weeks back that you and I covered in terms of the overview aspect of that kind of thing. So will she still stick to those 6 key priorities, or will that, like you say, there'll be a new version of it? I know in her first 2 days, obviously the first day was spent at NHS England headquarters. I suspect meeting the team, engaging with that. The second day, she was doing a hospital visit. So really interesting that, already starting to have some of those engagement opportunities and stuff to see what that means for the future. Really keen to know when she's going to visit her first general practice. I think it took Steve Barclay quite a long period of time before that happened. So it'd be interesting to see where Victoria Atkin's perspective will be when it comes to primary care. And I know it'd be interesting. I mean, I've already made the offer. She's more than welcome to come and see us at our practice if she wants to. And again, I will make that offer live on camera. Yeah, absolutely. You can come on the podcast and come and speak to general practice and primary care. We shall see.
Well, Gandhi, she does seem to like meeting people and shaking people's hands, because there's a tweet from the Department of Health and Social Care with a video just meeting people, shaking people's hands. So maybe we could be one of the people meeting her and shaking her hands.
Quick tidbit though, as far as I'm aware, she's the first Secretary of State for Health not to have a Twitter account.
That's very interesting for a modern politician, isn't it?
It is.
It almost feels like an absolute requirement. So that'll be interesting to see if that carries on. It's, in some ways, maybe it's healthy, maybe. to role modeling a healthy behavior there in terms of not being too engaged in social media. This is an interesting article, Gandhi, from Pulse reporting on some statements that she made about the industrial disputes in the first few days of coming into office. And she said she's committed to getting around the table, wants to seek a reasonable and fair resolution. Because the winter will be challenging. So that sounds like sensible talk, but of course it depends what's said when they get around the table, but possibly a little bit more of an attitude wanting to seek a resolution, or reasonable resolution to those disputes. So that's interesting.
It is. So, I mean, we've talked about new people coming in. I think it's also important we talk about people going away. We could talk about Steve Barclay and him demitting office. I mean, I don't know, Andy. Maybe there's an episode in there, the achievements of Steve Barclay as health secretary. Yeah,
I mean, he's not got a job now, right?
As far as I'm aware, he's not got an official position in government. He's still.
Oh, hang on. No. I think, has he become environment secretary
again? No, that was Teresa Kofi, wasn't it? It was
no, I think Teresa Kofi's she's retiring. Okay. Yeah, these are all the ghosts of Christmas past, aren't they? Oh, Wikipedia, you're showing behind the special curtain here. He's Secretary of State for Environment, Food and Rural Affairs. So, probably a demotion.
Change in role.
Health Secretary, potentially.
But instead, we are going to talk about a different person leaving, and that's Dr. Nikki Kanani, who has now looks like she's leaving NHS England. And now, obviously, long time friend of the podcast and the channel. She's been on the channel, one of the very few people from NHS England to actually join us live on camera and stuff. And obviously massive efforts that she made when it came to the initiation of the PCN DES contract, the vaccination program during COVID, transferred out of that role from Director of Primary Care to a different role, which has now been taken over by Claire Fuller, interestingly enough. And yeah, it looks like she's leaving NHS England after 6 years almost.
Yeah, there's the tweet. Bit of privilege working with so many dedicated colleagues. Our work is hugely important, putting patients at the heart of everything we do. I mean, she was at times controversial, but always a really good communicator, really visible, and was really willing, as you say, to come and speak to us on the podcast, which was fantastic. And speak to us a few times offline as well about various things, and always had sort of great positive energy. So I think she'll be missed, I think, by many people, and good luck for what's coming next. Do we know what she's moving on to, Gandhi? Do you?
I don't think we do. I mean, there's no comment of that in any of the articles and stuff, and I've not seen or heard anything from Nikki. I hope some of that is probably well-deserved rest. Probably some board games. So if you don't know, Nikki's a massive board game fan, similar to myself and yourself and things. So maybe there's something about people who like to communicate in general practice loving board games. I don't know. Maybe
I'm sure she'll do well, and bring that positive energy to whatever she does next. Moving on from positive energy to problems with the RCGP's simulated consultation assessment. So Gandhi, you've got trainees, so you might have had more direct experience of this. But what is the simulated consultation assessment, and what's been going wrong?
So, quick summary for those who don't know, the simulated consultation assessment is the new replacement for the RCA, the recorded consultation assessment, which is what was happening during COVID, which took over from the CSA, the clinical skills assessment. It's basically the key consultation-based assessment part of the general practitioner's training program. It's one of the 3 key things that you have to do if you want to become a GP. And basically, they've started a new version of this exam. It is exactly what it sounds like. It is a simulated consultation assessment. So I think if I remember rightly, 13 different cases with actors through a video consultation interface. That's one of the key things. It takes place in the trainee's home practice, typically, unless there's a reason not to. And as a result of that, they then have about 3 hours to do various different cases, and no examination involved in that because of the fact that it's through a video consultation interface. Unfortunately, there does appear to have been some significant technical issues in terms of individual trainees whilst they were sitting their exams, and I've heard some absolute horror stories about what's happened, and I really feel for those trainees who must have gone through that at the time. We all know how stressful it is when you're about to start your clinic and your computer dies. Imagine being in an exam situation and the computer system isn't working and you have paid over £1,000 to sit this exam. The stress that these people must be going through is significant. And as much as I know the RCGP have tried to prepare for this in terms of giving guidance, of which that guidance is a video on our channel to try and help people understand how to do it and my particular concerns and things that you need to check before you do it. But also they have sent test modules for people to run this. I just wonder if, unfortunately, it hasn't worked as well as they'd hoped. There have absolutely been some questions around whether or not this was an appropriate way to do things. What does that mean for those who have had technical difficulties? Do they have to resit? Do they get
a refund?
So the way I understand it is if there is evidence of a technical difficulty that impacts the result of the exam, then the trainee will get a free resit. They won't get a refund, but they will get a free resit. Doesn't take into account, though, for some of those trainees, and because this is the first time it's being run, there are going to be a cohort of trainees who are due to finish their training but had to delay it because of the changeover in exam process, and they may not get another resit before they're due to finish their training, and therefore, as a result of that, may have to have an extension of training because of something that is completely and totally out of their control. And that is a real issue for me.
Yeah, that would be unfair, wouldn't it? Let's hope they have the opportunity to, or they provide the opportunity to resit in a good time period in cases where that would be the case. One hopes that they would, but you never know. Never know.
And I think if somebody from the RCGP wants to come on and discuss this with us, absolutely, we'd be more than happy to facilitate that discussion with ourselves or with the trainees and stuff. But I'm sure there'll be more news about this coming out in the near future and things. Obviously, these sittings happened just last week. It ran over the whole week. But you know what? My heart goes out to those trainees. One of my own trainees actually sat the exam, and even with every single tech prep I could give him, he still had some difficulties. Thankfully, not as significant as some of the ones that we've heard, but you know what? It's still stressful. And I know he's put some mitigation requests in because actually it put him off his game. Yeah. So
fair enough.
We shall see. Yeah. So one more news story just before we finish. And it's a hot off the press one, isn't it, Andy? This one. So for those that haven't heard, there is a new Pharmacy First scheme that's just been announced. And when we talk hot off the press, we literally mean hot off the press. This morning, it has been announced by NHS England. And it's an interesting one, isn't it, Andy?
It is. I've not had much time to digest it, Gandhi. So you can indulge us all. I've not had time to have a look. And it might be that we do a more detailed discussion of this to put out at a later date. But what I did see, actually, because I keep my eye on my Google News search for top general practice stories and often have a look in preparation for the podcast, and there were a lot of stories about various things being available in pharmacies from the beginning of next year, which are obviously linked to this press release. All sorts of things, which I'm sure it was almost like I was reading a press release that's gone out 3 or 4 times in the last few years, actually. Contraceptives available from your pharmacist. I'm sure we've been told that that's coming for quite some time, but it looks like it's really coming from January 2024. So what's in this press release, Gandhi?
Well, let's have a look. So we're going to be looking at the NHS England press release version of this. Absolutely, there's other places I think you can look for it and things. And it talks about basically the reforming of Pharmacy First. Now, for some areas they would have had schemes called this before, but this then got replaced by the community pharmacy. Yeah, that's the one.
CPRS.
I always forget that. Yeah, CPCS and stuff, which was part, again, of the IIF. So the IIF has raised its head on this episode a second time. But basically, that scheme is now going to be replaced by this Pharmacy First scheme. In addition, they're rolling in things like you mentioned about being able to prescribe the contraceptive pill, as well as blood pressure monitoring and aspects in terms of referral aspects and things. And it's for 7 key conditions in particular that's going to be focusing on. So sinusitis, sore throats, earache, infected insect bites, impetigo, shingles, and uncomplicated UTI in women. The reason for that, these are thought to be consultations that are fairly easy to manage and diagnose and can often be resolved with simple treatments. Some of those treatments being antibiotics, and we'll come to why that's important in a little second and so. But it does involve some elements of assessment process and things. And this particular article does talk about the process, the payments, and that kind of stuff. It very much talks about combining existing principles, so the CPCS scheme and various other things into this. So as Andy mentioned, it starts from the contraceptive pill and the blood pressure monitoring from December the 1st, I think it is. Whereas the formal start of the Pharmacy First scheme for those prescription elements, I believe, was January, 31st of January. There you go.
31st of January. There we go.
Yep. There's some interesting stuff in there that it must be delivered from a physical site. So those distance-based pharmacy services will be able to provide some of them, but the one they won't be able to do is ear infection ones, so earache-based ones, because of the concept that they won't necessarily be able to look at it. And there's some weird rule in there that they can't deliver it from the sites that they are being based at as well. So what I think that means is if you've got a distance-based pharmacy service that has, for example, an office in the middle of Leeds, for example, they can't actually deliver it from their office. I think that's what it means. It's a bit hard to make out because it sends you some massive document that, to be honest, we did not have time to read. But hey-ho.
Okay.
The funding element it talks about, there's a really massive section that talks about overpayments and about clawbacks of overpayments and stuff. But the essential part that I think many people need to be aware of, so when it does start, there's an initial payment of £2,000 that's going to be given in December this year to those that are due to start the scheme. And then they have to have had a relevant gateway point by the 31st of March 2024. Then, per consultation, each pharmacy will be paid £15 for action of the action of the pharmacy first consultation, and that includes the blood pressure monitoring as well as the contraceptive pill consultations and the consultation for those 7 key areas. And then from February 2024, there'll be a fixed £1,000 payment for contracts who are delivering the minimum number of contacts. Interestingly, the minimum number of contacts for February is 1. Okay, goes up to 5 over the next couple of months. It then goes to 10 for the months after that until we get to August, where it goes up to 20 per month. And then from October 2024 onwards, it will be 30 per month that they have to hit. And there is some mechanism of clawbacks from pharmacies who haven't achieved those. And that's how they're planning on basically balancing some of the finance, as well as the additional investment that has been promised as part of some of the previous changes that were made. I think back to the Modernising General Practice document, I want to say, Andy, or it could have been the one of the other ones which I've forgotten right now.
Oh, I can't remember at the moment.
We've read a lot of documents, haven't we?
Yeah, it'd be interesting to know from pharmacists out there whether they think that the payment sort of structure is sufficient to make sure that this is made widely available. Because one of the problems with the CPRS scheme, certainly in our local area, was actually not many pharmacists felt in a position to deliver that when push came to shove. It was only 1 or 2 pharmacists which were actually actively delivering the scheme because they didn't feel that they had enough members of staff, in the pharmacy, to deliver it. They couldn't staff to deliver the scheme. So it'd be interesting to see if people feel that this is enough to resource that appropriately so that they can draw in the staff to deliver this widely across the country and in all areas. There's obviously some payment for getting going, which I think will help, and some ongoing payment, and then the item of service payment, £15, is comparable to what we would get in general practice for administering a vaccination, for example. A little bit more probably. So so we are able to put on an appointment with a healthcare professional for that sort of cost. So it feels like maybe that's in the right area, but difficult to know without knowledge of their kind of cost structure and costs in pharmacy. But yeah, interesting.
Yeah, some additional stuff that's worth being aware of. So it does mention about the fact that it doesn't necessarily have to be a pharmacist that does some of these things, in particular the blood pressure monitoring and that kind of thing. It doesn't make reference to that. It does talk about some of the tech changes that are going to happen in the background to try and make the GP notes more visible to pharmacists, including medications, observations, and something else I can't remember right now off the top of my head. But in terms of what they will have access to, and also that obviously that right back mechanism needs to be in there for the practices themselves to have the right information fed back in terms of what has been happening for those particular patients. I think that needs to be focused on from my perspective, because the tech inevitably always has issues when it comes to these kind of initiatives, and often goes either down to the wire or doesn't quite make it. And then you've got safety concerns about the appropriateness. And obviously when we talk about prescribing, if we're talking about pharmacists being able to issue medication, which absolutely many of them are potentially capable of doing, they are not capable of doing that if they don't have the full information about what the patient is actually taking, their allergies and other factors that may have an impact in some of this. So you do not want them prescribing things that they shouldn't be prescribing because they don't know that they shouldn't be prescribing it, which they can't really do without access to the records. It's going to be an interesting one from my perspective, whether that happens or not.
Yeah, and I'm just wondering whether there's still sufficient sort of funding there to make this this widely available, because it would be very helpful to reduce pressure on general practice in the health service. But sort of previous efforts have not been as widely available as they could have been. So let's hope there's enough in there to crack that nut.
Potentially. I mean, they're hoping this is going to deliver an extra 12 million appointments a year, Andy.
Yeah, I mean, it's difficult to comment on that on that ambition. Maybe it will. Who knows?
Maybe.
Obviously, impute the cost from that. They're spending a decent amount on it, aren't they? I think if that's the case.
Well, it does raise the question. Imagine if general practice got paid that much for those consultations.
Yeah, that's interesting, because no one's being paid for doing it at the moment. But so I guess that's how you bring online additional capacity. I guess it's additional funding for additional things. happening. Although it may well affect the case mix in general practice as well, because you know, a lot of GPs of old will look at that and think those were my catch-up patients. You know, I'm investing a lot of energy in frail, complicated patients suffering disadvantage and inequalities, and they take more than 10 minutes, but that's okay because, you know, I've got a few tonsillitis and earaches in my clinic to allow me to catch up. But if they're gone to the pharmacist, and in their place you're dealing with more complex, difficult, challenging cases, you know, that's going to be difficult, you know, and you probably won't be able to see as many patients as you used to, and the system needs to accept that. But we've waffled on for quite a while, Gandhi.
We have. I guess just one last point I did want to make on the pharmacy first scheme. One of the things it kind of half mentions is this whole concept and concern about potentially antibiotic resistance. Obviously, most of those treatment options are things that may potentially need antibiotic-based treatment. There is absolute concerns, I think, by many parts of the system that this could then lead to increase in antibiotic prescribing, appropriately or inappropriately. Concerns about it being inappropriate, to be honest, in some cases, and therefore, what does that have in terms of the resistance challenge? You know, we all know about global warming being a massive challenge for our well-being for the future, but actually, many people also consider antibiotic resistance just as much as a challenge in terms of the impact it has for the longer terms. Now, understandably, prescribing of antibiotics for infections in this situation is a component of that. It's not the only driver for that, let's be honest, but it has a factor. And there is some comments in there about that they may tail back some of the funding and opportunities for this if there is excessive prescribing as well. It's a consideration that I don't know how detailed it's going to be. This is not a detailed document, but there is absolutely some information out there that's useful to hear from. I think if there are pharmacy colleagues out there who do want to come on and discuss this with us, because obviously we only know one side of the coin, myself and Andy, we would love to hear the other side of the coin. Do let us know. We would absolutely love for you to get in contact and stuff and talk about this, wouldn't we, Andy?
Absolutely. And I guess we've had one or two comments from people watching out there. So it might be with I'll just bring one on now, just on pharmacy first. So Miss Melody, long time friend of the podcast, just mentions that she's found this service, found Pharmacy First, which was available, I think, in Nottingham for previously, really helpful for minor illness. So popular with patients out there, definitely.
So we hope you found this episode useful. If you do want to check out more information, definitely join us next week as we talk about how to look at GP appointment data. That's another document that came out recently that we've analysed in significant detail and depth. And I will be absolutely honest, if you are in any way involved in payments for your practice, if you're involved in your rota creation, or simply a PCN clinical director, a GP partner, a practice manager, you really need to watch this episode because it explains the document so well. But obviously we think that, but also it's really important information. And we actually show you what the definition of an appointment is in primary care. And I think that is something everybody needs to understand better and stuff. Don't you, Andy?
Yeah, there's the hook. If you want to, you think you know what an appointment is, but do you really know what NHS England thinks an appointment is? So so watch next week to...
Well, absolutely. If you want to find out, have a look right here. It's coming up. And as always, we will be here to help tech enhance your primary care and learning. And we will catch you in the next episode. Hope you have a great